Hi everyone, welcome to another episode of Psych Talk. Today I will talk about 3 disruptive behavior disorders: Oppositional Defiant Disorder, ODD, Conduct Disorder, CD, and Intermittent Explosive Disorder, IED. And while they may seem similar, each of them has distinct characteristics and challenges, and so let's get into it. I will start with Oppositional Defiant Disorder, ODD. So, ODD is often seen in children and teens, typically before age 10, and it's characterized by a consistent pattern of angry or irritable moods and defiant or argumentative behavior, and also sometimes a touch of spitefulness. The diagnostic criteria includes angry, irritable mood, so it gets easily annoyed and often loses temper. Argumentative, defiant behavior, so frequently argues with authority figures, actively refuses to comply with roles, and also vindictiveness, so shows spiteful or revengeful behavior at least twice in the past 6 months. An example will be a 9-year-old who refuses to do chores at home, argues with the parents and the siblings, and annoys siblings on purpose, and also argues with teachers at school and gets into arguments with peers at school. So these type of behaviors have to be present in different settings, such as school, home, and with peers. And prognosis for this disorder improves with early intervention, so the earliest the better. And if left untreated, it could lead to more severe issues like conduct disorder or even in adulthood, antisocial personality disorder. And treatments include parent management training, so we teach parents how to pretty much use positive reinforcement or negative reinforcement to make sure that their child acts appropriately. We also do family therapy and sometimes individual therapy focusing on emotional regulation. And so obviously a combination of different type of therapies and family therapy can be very helpful, especially if the intervention starts early. Okay, the other disruptive behavior disorder in the DSM is called conduct disorder, CD, which involves a repetitive pattern of violating others' rights or societal norms and usually appears in teens. It's more severe than ODD and includes aggressive behavior, deceitful behavior, or destructive behavior. The diagnostic criteria will be aggression, so physical harm to people or animals, example bullying or cruelty, destruction of property, so deliberately damaging belongings or setting fires, and deceit or theft, so lying, shoplifting, or breaking into houses, and serious rule violations such as running away from home, skipping school, etc. An example will be a 15-year-old who frequently skips school, vandalizes property, and gets into physical fights. Prognosis depends on the age of onset and severity, and early persistent behaviors may lead to antisocial tendencies in adulthood. Treatment focus on therapy, particularly cognitive behavior therapy, and obviously addressing core issues like substance use, if there's any. But again, conduct disorder as well as ODD if left untreated, and if not, if the intervention does not start very early, or pretty much can lead to antisocial personality disorder. Not in all cases, but in many can. Okay, and the other disorder in the DSM is Intermittent Explosive Disorder. IED involves sudden intense outbursts of anger or aggression that are out of proportion to the situation, and it's more common in teens and young adults and often beginning in late childhood or adolescence. The diagnostic criteria is recurrent impulsive outbursts of aggression, such as yelling or physical fights. And outbursts are not premeditated and cause stress or problems in daily life. And these episodes are brief but very intense. And an example will be a 16-year-old who punches a wall or throws objects when frustrated, but then quickly feels remorse afterwards. And the prognosis and treatment. So the prognosis is better when individuals learn coping strategies early, and without treatment, it can affect relationships and job stability. Treatments include, obviously, therapy focused on impulse control, but also some medications such as mood stabilizers. And I want to kind of differentiate three of them. So the key differences among the three will be that ODD often starts with defiance and irritability, and behaviors are non-aggressive and less severe. And CD, it escalates to more serious violations of rules and others' rights, often involving aggression. Whereas IED, it's focused on sudden, intense, and impulsive outbursts of anger. So it's not premeditated like in the case of CD, where they might actually think, okay, I'm going to do this specific thing because I know it's going to harm somebody else. So early recognition and intervention for ODD, CD, and IED are very crucial in reducing the likelihood of developing antisocial personality disorder. And treatment not only helps manage the immediate symptoms, but also addresses underlying issues that could lead to a long-term patterns of harm or dysfunction. And this shows why it's important to see these disorders as part of a bigger picture in how mental health develops over time. And that is it for this episode. I hope you enjoyed it.